So this actor creates this character? Not quite. This performer produces narrative elements that contribute defining the characterization. This is possible thanks to a very strict discipline of the body, a codified body learning that allows traditions to travel through time, through space, preserved. It also allows people to reproduce or to recreate their culture in the event they have been destroyed. But these narrative elements, you saw body and one prop. There's more to it. There is costume. There is makeup. There are props. There's decor. And there are different levels of this. These bodies don't become like this just in a jiffy. It takes time for the performer to transform into the character. This transformation is something we call the fictive body. The actor is no longer the actor, but not the character yet. And then when it's finished, and he goes back to the wings, he's no longer the character, but not the actor yet. The fictive body. All this is duly noted. These are the notes that my Japanese master writes to organize these choreographies. By the way, I'm not Japanese. My body is not Japanese. This is a piece of Nihon Buyo, traditional Japanese dance. It's called Akusen, the white fan. My master has imprinted in my body a series of messages. In my proprioceptive system, postures, gestures, she has helped me organize an architecture of movement. And don't even have to really think about it. I rehearsed today because of the floor. But really, these are ingrained in my body. Here you have the notation for the choreography. You have some notation for how to perform your makeup. This is useful, as I told you, when it gets to recreate a culture that may have disappeared. The restoration of culture, reenactment, how to recreate, redo what was once. Here, the onsen, the traditional bath, the tea ceremony, music, the playing, the making of the instrument. This has been inspired to me by Eugenio Barba, an Italian film theater director, who has created a group named the Odin Teatret, now in Denmark. They celebrated 50th birthday last year. These actors work very much in this spirit of theater laboratory. What Grotowski, Barba, Brook, other people in the 20th century have created. Theater laboratory is where you exercise, train, and really work on your body. It's more on rehearsals than it is on the performance itself, let alone show. There's another thing that Barba has created with other people. It's the International School of Theater Anthropology. International, comparing these learnings, codified learning, these fictive bodies, comparing feet, comparing arms, postures across cultures. India, Bali, China, Japan, plus the European, plus later on the African Brazilian. So this has been extremely interesting for me to apply in cultural psychiatry, or should I say in cultural medicine and psychiatry, because I consider surgery and internal medicine and gynecology and pediatrics as much as psychiatry, of course. I have built a stage at my consultation where I do that, theater laboratory. The dramaturgy of the actor, the dramaturgy the story, the subscore, the subtext, what the director imagines, what the actors will bring from their own archives into the story making. What the spectators will do, because now you are participating in my presentations. You are reacting to what I'm saying. You are present for me as much as I am for you. We are making a performance together. So the patients have a case history. A case history is dramaturgy. The case history making is precisely what they do in theater laboratory. The therapeutic work in progress, be it surgery, internal medicine, psychiatry, it is also something that can be organized in terms of a narration, the written text from which you create a performance, the performance text from which you create the written text, the verbal, the non-verbal, etc., the costume, the makeup, the decor. Layers. When somebody tells a story, you may perceive something in the surface, but actually guess or anticipate what's somewhere else. So all this also precedes of montage, which is something I will develop a little later. I was interested in theater laboratory and in these directors who have created, this is Jerzy Grotowski's Acropolis. It's post-traumatic theater. He, Tadeusz Kantor, other Polish director, and others have created this post-traumatic theater. Here it's two photos from a real concentration camp, and this is the performance. Documentary theater. In documentary, meaning that the actors have to learn what happened to the people in reality. So the actors have in their archives, in their body archives, all sorts of information, of trials, of impros, of repetitive actions, of rehearsal. They have something that they have taken from reality. So you can see that what is the transformation with patients? From actor to character, from healthy to ill, from ill to dead, or in some sort of chronic state, or healed. These transformations are exactly the same kind of transformations. Richard Cieslak is a Grotowski actor who created a performance of a person who was tortured. This was during the Inquisition, but frankly, war, disasters, genocide, where it took place, and when, for an actor, it's all the same, unfortunately, it's always the same process. So what you learn, you have a great choice, sources to be able to learn this kind of thing. What he does, my patients do too, but they don't know they do it. This actor and other actors, like at the Odin Theatre, they create a master class that they call the art of the performer. This is where I come from, this is where I studied, this is where I learned voice, this is where I learned dance, and they create something that is a sort of case history, a profile of the actor. But the actors are aware that they're doing this. Patients are not. Oh, you have multiple sclerosis? How do you manage to be so much at ease with your condition? You have Parkinson's disease. I think you're doing quite well. Oh, you know, I've coped with it. Yes, but how exactly? So you can dissect with your patients what they have learned. Maybe they don't know exactly what they've learned. So it's better that they know, first, because they can organize their knowledge. Second, because they can transmit it to somebody else. I've been myself through cancer, a throat cancer that was operated, and I had radiotherapy. This voice is my normal voice. I was helped by a lyrical artist after all these treatments, although I'm rather a blues person, but I mean, that was great for my healing. So I learned something from this experience that I could transmit to other people. I told my surgeon, if you ever have somebody who has the same condition, please tell me to come and I can talk to this person and tell him or her about what I've been through. At the consultation, I tried to help patients express what they have. Nobody is not eligible for acting, dancing, drawing, etc. These are drawings that I made under the directions of my patients. This is a person who had suffered abuse during childhood, sexual abuse. This is a woman who was just raped. And these are not what they look. They look just like anybody here. But this is how they perceive their bodies. An opening to the whole issue of dysmorphophobia, body image disorders, whether you see it or not. Some are visible, some are invisible. But sometimes, you know, when people come to the consultation the first time, you feel there is something like this. You don't tell them. You wait for them to be ready. But this is something we have to, of course, explore. There is no body in these drawings. It's a cell, the four walls, the ceiling, and the floor. Here is the trace of the body. The person said, I've imagined this place where I was so mistreated. I didn't want to draw my body. It was too painful. But he drew this. So that was another way to approach the narration. When somebody has mastered the suffering, the trauma, and how to cope with it, eventually to move toward resiliency, this person masters his condition. We heard this morning persons who have mastered their condition through visual arts. This is another way of doing it. A person who masters a condition could do more than the actor and the dancer, could also acquire a competence as a choreographer, as a director, to organize and to design their own masterclass. If a patient is a master, the person is no longer really dependent on medicine. We are really talking in equal terms. This is just one example of master of condition, the can-do company of people who are, as you see, able-bodied, others are not. And they work together, which is even more interesting because everybody gets used to the other people's configuration of body and experience. This is Frida Kahlo. I have a common point with her. I had polio too and was re-educated when I was a child by a dancer, which is probably why I like dancers. And she documented her story. The polio, the accident she had that left her crippled, the way she was mistreated by many people around her. And she is one of those artists who, as a patient, managed to document this, and as was said this morning, in a very healing attitude and a positive and an action activist in her own healing. So the collective body of the person who belongs to a story of war, of genocide, of disaster, of epidemic, or a group of illnesses, I mentioned Parkinson or diabetes or others, these persons are emblematic. I'm emblematic of polio, for instance. So what does it mean? You represent this, but you should not remain in a state of victim. If you are emblematic, it's a responsibility. So I represent this illness. I've managed to cope more or less with it, but I have to communicate this to others. Then I become a performer and possibly a master and somebody who teaches. So I'm a transmitter. This is Tadeusz Kantor, The Dead Classroom, an issue that I find very important with collective traumas. It's the problem of ghosts. All my people are dead, said this man from Rwanda. Indeed, he had absolutely no more references. So that was interesting to see staging actors carrying life-size puppets that represent their dead childhood. It's also akin to the theme of reenactment. This is Marina Abramovic, former Yugoslavian body performer. Interesting, the term body performer, using the body as a canvas for the performance. She's here sitting on a pile of beef ribs, raw, that she scrubs in sort of a trance, and she called that ethnic cleansing. Reenactment, because it reenacts not only the culture, but also the trauma. I like it that we're inventing the post-traumatic stress disorder that is diagnosing not always the person, but also the cause for the problem. Trying to describe the trauma and try to profile the trauma as a sort of serial killer, if I may compare. Codified body learning, organized learning from the interior that creates this ease that you can have with all these practices where you learn your body through yoga and other practices is one thing. I would like to possibly in one of these next days prolong my conversation about non-codified body learning when the references are different. I was impressed by Francis Bacon's interview, something very interesting that he made for the BBC once, talking about this, the body without skin, without bones. Do I draw before I paint? No, I don't. I don't care about the skeleton, I draw flesh. And he came up with this comment about man who suffers is meat. That, for me, opened a lot of reflection. This is Suleiman, one of my patients who was from Kurdistan in Turkey, suffered torture where he was hooked on a hanger, like a piece of clothes. So I did these drawings here because the wires were for the electric wires through which they gave him the shocks. You know, you can also notice that he has no more sight. His sexual organs are just not even elementary. He doesn't have feet. So the body image disorder was very severe. And to treat him, I first had to desolidarize his body from the instrument of torture. So in the first step, there was to put apart what was his body or what remained of his body and these other elements. Now, what he did unconsciously, I mean, what happened to this man, some people do it on purpose, like Stellark, who is a Greek-Australian body performer again, who uses these machines, implants, and other machinery to create a reflection about the body limits, about the cyberpunk, about the robots and all these, and who eventually worked with services of orthopedics to design prostheses. And this is yet another prolongement with the robotic surgery, which I put here as just a prolongation, but also because in robotic surgery comes an issue about the non-codified body learning and this transformation of how to approach body with imagery, with robotics, etc. It's the changes in the patient-healer relationship and how people's fear of an operation has changed. The way you reassure people changes. It's an adaptation of the new medical actor performing for the patients. And this is Orlan, the French body performer again, who uses her body to make a statement about the limits also of the use of body. It comes from a story about the making of happiness through plastic surgery and other artifacts. And she made a statement about women's tyranny of beauty, using her own body for this. Now I'm going to leave this train going on for the workshop, and I'm going to conclude with just a few words about this. Normally, this presentation lasts 17 hours and 30 minutes. But how did I manage to shrink it down to 20 minutes? Editing. And I have a good master here for editing. So just a few things, because indeed we have a lot of narrative material, verbal, non-verbal, written, performance, etc. And we have to organize this. I have a friend in New Orleans named Kevin McCaffrey, who makes documentaries, documentary films this time, about resilience for people after the Katrina experience. for the Cajun people after the oil spill and the fact that the whole culture is endangered. So he has performed interviews, he has collected archive, soundtrack and other things, and this is organized like this, which I pretty much do too with my patients, using storyboards and organizing the different layers of their narrations to make sense together. And to finish with my presentation, this is the Odin Theatret, and this is a, you may not know, but they have group performances, they have duets, duo performances, they have solo performances. This is a duo called Salt, the story of somebody that they have staged. This is the performance. Roberta Carreri, first front, and Jan Versleo, an actor, musician in the background. He also writes the music for them. That was a night performance. Next morning, the two actors explained us how they conceived and how they rehearsed, in other words, the making of Salt. Each of them also has a masterclass. He with his experience and itinerary in music, she with her influences of Italy, of the Butoh that she studied in Japan, with other such experiences, voice and so on. And I'm interested in taking notes in which this is like a storyboard. I do this with my patients too, and we check that together. Telling the story, what it reminds me of, like interpreting, dreams or stories, giving tracks, finding illustration, mixing together the drawings and the writing, which I find extremely interesting. And many examples, but I don't want to tell too much at this point. Because this is the last story I'm going to tell you. This is Roberta Carreri. She's a very good friend of ours. She gave me permission to tell about these stories. And this is her husband, Torgeir Vetal. These two are actors at the Odin Theatret. These two have prepared a demonstration where they explain how they work to create characters. In this instance, Nora and Torvald from the Ibsen's The Doll's House. And Roberta was explaining, for instance, the story of this woman who is looking forward to go to emancipation, so she walks open, but she's pained because she knows she's going to have to leave her children at home. And she explained the whole development of this. In 2010, Torgeir died of illness, and 2 months later, she performed this alone. His table and his chair were there, so I realized that she was having a 3-level grief. She lost her husband, Roberta lost Torgeir, the actress of the Odin lost her partner, actor at the Odin, and her character, Nora, lost his character, husband, Torvald. And when she said, my actor's score has helped me cope with the situation, I really got yet a new track to work with. Thank you very much.